This is my peak expiratory flow rate scale station. The scenario is you have been asked to undertake the peak expiratory flow rate for Henry Bond. All the equipment you need is provided. It is today and it is 9 a.m. On entering, I'm going to ensure that my scene is safe and that the curtains and windows are drawn for privacy and dignity of my patient. Good morning, Henry. My name's Sarah and I'm here today to do your peak expiratory flow rate with you. I just want to check before we get started, Henry, have you done one of these before?
Yes, I think so.
Yeah? And do you roughly remember what your average was last time?
I think it was 450.
The reason I ask, Henry, is because we're going to use your 450 as a guideline for today's result. Is that okay with you?
That's fine, thank you.
Perfect. I'm just going to step to the side and assemble all my equipment needed, and I'll be back with you shortly. So first of all, I'm going to wash my hands following the WHO guidelines. Expiry is 12/20/27. I'm happy to use. Take an ample amount, palm to palm, back of the hand, fingers interlace, fingers interlocked and vice versa. Fingertips, rotation of fingertips, rotation of fingertips, rotation of rubbing of thumb, rotation of rubbing of thumb, rotation of rubbing of wrist, rotation of rubbing of wrist, and leave to dry for 30 seconds. I'm happy 30 seconds has passed. Examiner, can I just check, please, that my trolley and tray are clean and ready to use?
They are clean and ready to use.
Now going to don an apron. And get on some gloves. Examiner, can I just check, please, that my trolley and tray are clean and ready to be used?
They are clean and ready to be used.
Thank you. So for my equipment, I've got one disposable mouthpiece and peak flow meter, which I can see is intact, and so I'm happy to use. I'm going to securely place my disposable mouthpiece in the end of the peak flow meter and ensure that the gauge is on 0 and is ready to use. Hi Henry, I'm back. So what I'd like to do first, if it's okay with you, is just to get you in an upright position. This will give us a better chance of you being able to get a better reading on the peak flow. Is that okay with you?
That's fine.
Perfect. So what I need you to do first of all, Henry, if you could hold this horizontally, ensuring that your fingers don't impede the gauge at all, otherwise this will affect the reading. And what I need you to do is take a full inspiration in. I then need you to open your mouth, placing your teeth and your lips around the disposable mouthpiece, creating a tight seal. And then when you're ready, a short, sharp huff into the meter to get your recording. Is that okay?
Yes.
Perfect. If you're happy to start now. Brilliant, thank you. I'll just pass that to examiner. Thank you, Henry. So your first reading is 360. So I'll make a note of that now. Perfect. Henry, how are you feeling?
I'm okay.
You're okay? So I've just put the gauge back down to 0 for you. Are you happy to go again with your next recording?
Yes.
Okay, perfect. So same again, full inspiration in, mouth and teeth sealed around the disposable mouthpiece, and a short, sharp huff. Brilliant. Well done, Henry. Perfect. So that recording that time, Henry, was 400. So that's a really good reading there. So we will document that. How are you feeling, Henry?
I'm okay.
You're okay? Put the gauge back down to 0. So your final reading now. Are you happy to continue?
Yes.
Perfect. So same again, and then we'll get see what your highest reading is and get an average there. Brilliant. Well done. Well done, Henry. So your final reading was 420. So we will just make a note of that for you. So obviously, Henry, this is a little bit lower than what it was last time. So what I will do is I will feed this back to your GP and let them know, and they will contact the correct people about this. How are you feeling since doing that? Are you feeling okay?
Yes, I'm okay, thank you.
Perfect. Okay. What I'm just going to do, Henry, is I'm just going to dispose of all my equipment. Okay. Do my hand hygiene. Okay, I'm now going to document Henry's peak flow. So as he is 66 years of age and 175 centimetres tall and he is a man, I will plot it accordingly. Okay. So according to the normal values for a peak expiratory flow rate, Henry's should be at the 530 litres. Hi Henry, I'm back. So I've now plotted the peak flow readings that you've done for me today. So normally what we would expect of a man of your age and height, we would expect a reading of about 530. However, please don't be worried about this because I know you said last time your reading was about 450. So actually the recording of 420 today was closer to your average. But what I will do anyway is I'll document this and contact your GP. And obviously it'll be a conversation with him about whether or not they want to up your reviews for this. Does that make sense?
Yes, thank you.
Yeah? Have you got any other questions about today?
No.
No? Okay. Can I just check before I go, Henry, have you got the contact number for your GP surgery?
Yes.
And you're aware that if you need to contact anyone, it's 111 for non-emergencies and 999 for an emergency?
Yes.
Perfect. Okay, well, thank you very much for today, Henry, and I'll make sure to document that, and I'm sure you'll hear from your GP soon.
Thank you.
Thank you. Just do my final hand wash. End of station.